Okay, we have various program for learning process. The one that we use is it's just like a CHA in action guideline and chapter. You see the second one, understanding and practice CHA criteria. That means to solve the problem of what is CHA and why we have to do CHA, and how to implement for the first step. Okay, for the lab, the first lab. That the spiritual health care skill or soft skill training. We have CHA skill, meta skill, growth mindset skill to make it up in the course. And the third one and the fourth one, the last one, the fourth one is the CHA expert training program to make the system that recognition by the survey system. So for training program, we simply call it just like a CHA facilitator episode 1. Most of the content is created by to learn what and why that I mentioned before, including how to implement in the organization at the early phase of the CHA implementation. And then we leave organization for, let's say, 3 to 6 months, and then set a second workshop for the organization. We call CHA episode 2. So this episode, we will make more understanding about the guideline, that it chapter guideline, using CHA skill in workshops such as deep listening, focus group interview, in-depth interview, narrative medicine, and deep reading skills, so on. The organization will then proceed their work, follow with the the guideline that we explained to them already. And then set up the system in their own organization, their own hospital. And then we also set up the consulting system which run by HAI CHA expert. Right now we just create up the CHA expert in Thailand. Okay, and then we this slide just show about the CHA skill, meta skill, and growth mindset skill that need for implement the CHA model in the organization, just like a deep listening, self-reflection practice, self-awareness, team awareness, organization awareness skill, mindfulness skill, telling story, narrative medicine, work with enjoyment, safety and sharing, creating and learning. So the whole thing is just we call in the conclusion that it's just like a spiritual health skill altogether. So, and for the certification aim, we have two track, right? The learning track we already discussed, and for the certification aim, another track. We set up it into the recognition system with the sub-processing as follow. We prepared the tools for survey visit, including the organization profile format for this system, self-assessment form, how we have to report the working that associated with the CHA system to the surveyor, something like that, and for themselves to assess scoring guidelines, and then judging process step, and also the survey report form. So we're setting up this all thing with the group that we call the working group for integrating spiritual dimension healthcare into practice. We have the body, this one, the body. As far as this one, I am sitting at the head of this grouping. Okay. In the certification process, we have planned to make it into the systematic, but in step by step. At the first period, we just like to make it like a appreciation, not just appreciate. Okay, and step forward is certification. Right now, we in the process of making it into the certification that I call PDSC CHA certification. So, because this already established in the system of HAI recognition system already, so it's easy to make it into this way. So, in the future, we will add it on, and then it's the ultimate for the future is the accreditation level. So that we need the outcome that come from the CHA model, CHA implementation, and let's say we can have the result from this process. Meanwhile, we have another group that we have to make it into the surveyor training team to train the surveyor, because the surveyor that will survey the CHA organization, they have to know about the, I mean, in depth of the content of the CHA model as well. Set the specific course to train them to be a CHA surveyor, which we recruit all these person from the HA surveyor that already established. And we, at the first time, we just asked for the who interesting in this field. So, and then we group them, and then just make it in the competency of the CHA content. So HAI will, I mean, right now, will collect the data from experience to build learning appreciation for future certification. In the future, we will make it into the certification and accreditation level. Actually, HAI Thailand try to put this aspect into the standard that we already use it, and then we will make it up into the, I mean, the version number 6, the 6th version in the near future, and we put the, I mean, spiritual aspect into that version in the future, near future. Okay, so this is the principle for CHA training program that I has mentioned already. But when we go to certify or accredit some organization, at the PDSC survey team, they have like a expert from, I mean, content expert, and then they have the I mean, HA expert to make it up into the team to be survey the hospital. But for the CHA survey team, we will have the CHA expert and content from the, I mean the quality expert all together, make it up into the team, and then go to the hospital for certify or for accredit or appreciation. So that's already set it up like this. I just I mean, compare for the HA aspect and the CHA aspect into the table, using the 8th chapter of the CHA. For the left hand side, you can see the leader for the HA vision. We have to make it very clear direction, right? For the CHA model, we need wording or reflect from the wording that reflect the spiritual dimension. Because if the vision have the spiritual dimension, so the implementation is easier for the population in the organization to go to. Okay, and the leader in the HA aspect, we guide them to standard for safety and quality only. But for the CHA, we ask for how to lead with spiritual dimension. This is the example. And for another example, it's just like a work design. For the HA standard, we try to search for the QA quality assurance, the CQI quality improvement and process management, and use the 3P concept: purpose, process, and performance to continue the quality level. But for the CHA, we need another thing add on that recognize the need and lifestyle of both recipient and service provider, and the endpoint is happiness for both. Another example is just like okay, for the work system that indicate into the care process. In the CHA model, we need the considering of the human dignity, both patient, relative, and personnel. Let's say like some question like what do you want but the hospital hasn't done yet, something like this. And then maybe the spirit of the patient or spirit of the healthcare provider is the fifth vital sign for them as well. Okay, we need to interpret, we need to recognize that this vital sign level is just up and down or just get sick. The eighth item is healing environment. We have another part apart from the external environment for the HA standard. We have internal, interpersonal, and behavioral healing environment in the group of healing environment altogether. Okay, then let's go to the SAR that I have make it up and will use it in the very near future. Okay, the document that we have to, the surveyor themselves had to, study before go to that organization or hospital. We need the hospital profile, use the current one that they have it, and add on the chart-driven approach that they use. Okay, for the SAR or self-assessment report, have to report in two parts. The first one is part one is process of that according to the 8th chapter of the SHA guideline that I mentioned. The part two is the result from the operation or from the process, and we decide into 4 aspects of the result. And another result we have to add on with another platform, okay, like process management or process analysis regarding the spiritual dimension in important work system, especially in HR, human resource, and patient care system. Outstanding of the CQI, 2 or 3 example. Both of these can presented in any other form of the paper, such as video clip or short film or interview or storytelling. It's up to the story. Okay. Then in the self-assessment report, we just, for example, have to explain the process and lesson learned from the development of each category of standard by add to the principle of writing according to the 3P system that we set, like to achieve the goal of leading the organization to drive the spirit of work. It is carried out as follow: 1, 2, 3. Just report. Okay. For example, I just use chapter 1 and chapter something. Okay. In chapter 1, the organization leadership, we need. This is the something like the measurement data. For example, not the must. It's just like the example, like a number of leaders who have the ability to act as spiritual example, something. Okay, this is an example. And the other, like chapter 7 is patient care system. The data that quantitative measurement will go to the unit or patient group that indicated with spirituality. In the first part, we need something like this for the result of the process. And in the future, outcome of this process will come up to the clinical outcome that relate to the spiritual dimension provide. And then we get it up into the scoring guideline. Okay, just make it. We use it, so it's in Thai. Okay, and we have the detail of the scoring to make the judge or the surveyor understand and make it into the touching point of the scoring to resolve the problem that some people ask for. How do you know? How do you know? Okay, so I will end up with this one. By this approach that I mentioned, we believe that CHA will shape the hospital to be a hospital of human dignity. That is the people or patient-centered care, as we have put it in this topic. Okay, thank you very much for attending this session. Okay, and I will use this one for build it up when I need somebody to to get along with us in the CHA model. If you want to make your working life valuable and meaningful, let's join CHA. Thank you.
Thank you so much อาจารย์ชเนน and อาจารย์แม่ต้อยค่ะ Now we have a question from the Zoom. Oh, okay. We have 3 questions from the Zoom. I may read for you, and we can show the question in the slide. So at the meantime, I think the hospital would like to have like human dignity in their soul, and as to pass to the patient will get the more or better result from using CHA. So we have the first question is about how can hospitals effectively measure and assess whether they are truly adopting CHA or people-centered both patient and staff approach in their operations.
วิธีประเมินครับประเมินคนกับคนไข้ประเมินยังไงไม่เอาก่อนไหมเดี๋ยวผมตื่น
Thank you for the question. I will answer your question first, and if not enough, Dr. Chanen will later together. So in everyone, when we start the CHA program in ever in Thailand, the first question is, do you have a indicator? Do you have the measurement system? So this is a basic question I got, and I'm happy to sharing this concept with you. We also have the measurement in CHA program because the purpose of the CHA program is we want to increase the spirit at work for the healthcare staff. So we have to know it is increased or not. So how to measurement the spirit at work is we have many ways. The first thing is very simple. We make like the measurement score for the spirit at work, and we suggest the hospital to use this measurement after they implement just for a while to have the content enough to measure it. The other way is we measurement from the what we call is transcendence of the healthcare staff. They have to change the behavior, and it's a move to the behavior is fitting for the organization, good behavior for the organization. For example, more engagement, more happy, more satisfaction, or work with happiness or something like that. We have many measurements for the transcendence of the healthcare staff. The second measurement we focus on the patient care process. The patient care, if we use the spiritual integrating spiritual care, the result must be better. So we have to suggest the hospital to compare before and after project, which is what is the difference. For example, how to the patient deal with the suffering, what is the occupation rate, and whatever, even the safety, because we know that if the healthcare staff have mindfulness, have the spiritual growth, it tend to be that the patient the safety much better. The accident must have changed, reduced for the incident from safety. So that's all be measurement from the after the CHA program implementation in hospital, and especially when we go to recognize or certificate them. Maybe Dr. Chanen have another to put it more. Thank you.
Thank you, Dr. Rongsamon. I will add it on another point that Dr. Sumon mentioned is we call the level of the spirit at work, because we identify the component of the spirit as four components: inner life, meaningful work, community connection, and spiritual connection. And we use these components make it into the questionnaire. But this questionnaire will affect or effective when the people in that area, I mean in the organization, have the safety zone to answer and understanding to answer. So if we, I mean the only, if somebody asks me that only one question that you ask and then can identify whether the supervisor at work in that organization is already get it or not, I will ask only one. Till now you have the happiness or not. That's all. But the happiness will, will answer with the safety zone or not. And safety zone can identify by the surveyor. When we use the technique for soft skill, like in-depth interview, focus group, because we cannot lie the whole organization with with this question. So we can pick up and use the outcome of interview for interpretation to level up the organization that reach some level or which level of the measurement of the CHA model. So this already put it in the scoring guideline that we have see this, see that, and understand this and that. And you see, when we will go to survey some organization, we need another form document is video clip, story, or just like short film or something, to see whatever or what happened in that organization. Okay, that can be identify or measure the organization in the level of the CHA model implementation.
Thank you, อาจารย์ชเนน อาจารย์แม่ต้อยค่ะ So in the near future, maybe we expected to have the assessment too, like our two speaker is talk about, because now it's not in the slide at the moment, but I'm sure it's going to go in the nationwide and also international with the translation. Yes, I'm sure the other country doesn't have this kind of standard or kind of the certification or recognition yet. Yet.
Okay. Right now we have it in the first draft.
Right.
Already.
Right. So we're looking forward on that.
Okay.
So we still have the next two questions.
Next two or next one?
I think next two, ค่ะอาจารย์ So you may show the. Here, this is second one, ค่ะอาจารย์ How can hospitals effectively integrate AI, artificial intelligence-driven technologies to enhance efficiency while ensuring that human empathy remain at the core of patient care?
ไปให้ว่าจะใช้ AI ได้เว้นมา enhance efficiency แม่เอาเลยแม่เอากันเอาเลยแม่ต้องนำหน้านะครับ
Thank you for these challenge questions. Yeah, you know this question we also have in our seminar now in the other room. So we know that now AI is playing a very important role in every healthcare center. But you know, we think that even AI maybe cannot work instead of the human, because human have something more than that. Human have love, have compassionate. Human have touching. Human have respect. Human have trust. Human have support each other. And I think that human can work in the kind of complex environment is better than AI. AI is the best in healthcare, but we can use AI for assistant the healthcare, and healthcare can make the time they have more, because AI assistant us already. In some area we don't have to work for collect data for something, but we can use the more time we have to close with the patients, to empathy them, to love them, to understand the patients. So that's why we can work with AI, but we should put more empathy. We should put more the spiritual in a healthcare setting, because some kind of activity we don't need to do because AI much better than us. But some activity AI cannot instead of human. So this is we think this in our country. Thank you.
อาจารย์ชนิน you want to add more answer
Yep. Okay. I think this question is very I mean challenge me, because this thing is still in my head as well. Because in the future, I think we can use the AI for our assistant to identify like the wording, I mean the timing that doctor and patient use together, and the wording that doctor mention and respond by the the patient, and this I mean connection can interpret into the spiritual level. I think in my head, but it need time to identify, because human is human. This one and that one is not the same one, so it's quite difficult. But I think maybe in the future, but not near future. Okay, is that up to? Okay, thank you for
Thank
this
you
question
ค่ะ
as well.
so